The Ebola epidemic broke out in West Africa early this year. The disease continues to spread out of control, with the death toll rising every day. So far, it has largely been contained in West Africa, but fears are growing that it could become a global health emergency, not just a regional one. The first cases are showing up in Nigeria, Africa's most populous country. With no vaccine, no cure, the outlook for getting the crisis under control looks grim. We begin with this report from CCTV's John Gilmore.
It is the world's worst outbreak of Ebola since the deadly virus was first discovered in Africa in 1976. Since February, more than 1,700 people in the West African nations of Guinea, Liberia, and Sierra Leone have contracted the disease. And some cases are now showing up in Nigeria, where a national emergency has been declared. The survival rate is low. About 60 to 90% of cases prove fatal. So far, more than 930 people have died.
So this is an emergency, and we are already in trouble. We are already fighting something that is very, very large. It is going to get a lot larger if we do not get a lot more resource.
The virus is spread by contact with bodily fluids and blood. It is highly infectious and attacks the internal organs. Symptoms include fever, weakness, muscle pain, diarrhea, vomiting, and bleeding. Many of the cases have occurred among people taking care of family members. Even burying the dead is hazardous. Contact with the body before burial or failure to use protective clothing can result in contamination. Several doctors and nurses have died treating the disease. One of the big challenges is education and prevention.
The most important thing is, regardless of where you live, what you do, where you go, practice good personal hygiene.
Another challenge is providing resources and infrastructure. There are not enough doctors and health workers to battle the disease as the number of cases grow.
This outbreak highlights the need for us to enhance our efforts around global health security everywhere in the world.
At a summit with African leaders in Washington this week, United States President Barack Obama has promised international support.
The United States and our international partners will continue to do whatever we can to help our African partners respond to this crisis and to stand with the people of Guinea, Liberia, and Sierra Leone.
The World Bank has pledged $200 million in emergency funding. But the big question now, can the disease be contained in West Africa? Or could Ebola become a global health crisis? John Gilmore, CCTV, Washington.